my name is Tracy. I'm going to be your nurse for today. I'm actually going to do your head to toe assessment, but before I begin that, can I get some general information from you? What's your first, last name, and date of birth?
Emery Grace Williams, 12/16/10.
Awesome. And then, so before I begin the assessment, I'm going to run over your vitals. Your temp was 98.6. Your pulse was 70. Your respirations was 16, and your blood pressure was 120/80. Today, like I said, we're going to go over your head to toe assessment, and to begin with that, I'm first going to start with your neck and lymph nodes. All right, and your skin looks good, no lesions or discoloration. It's appropriate for your ethnicity. Let's see here, no trauma or anything. I'm going to next palpate your pervicular lymph nodes. Let's see. Okay, and now I'm going to go behind the ears right here to the posterior, and then the occipital behind the neck, submental under the chin, and submandibular right here on the neck. Okay, and next I'm going to check, let's see here, I'm going to go down right here, down the neck in the interior cervical. Behind is the posterior cervical, and just a little bit more down is that deep cervical. And then I'm going to do the same to the opposite side. So again, interior cervical, posterior cervical, and then down lowers that deep cervical. And then hunch your arms just like this. Perfect, and that's your clavicular testing. Okay, now I'm going to assess your nodes, which is cranial nerve number 1. Your nose looks symmetrical from you just looking at me. No trauma. Now I'm going to look at it with the light. Okay, turbinates intact, septum not deviated, mucosa is a slight pink. Okay, and do you have any pain with your nose or anything? Okay, perfect. Now I just want you to smell this pepper right here. I'm going to have you I'm going to have you smell this salt, and then before I do that, I'm going to have you just take one hand like this and push it on your nose. Blow, breathe. All right, now do the opposite. Okay, perfect, breathing. Now smell this and tell me what you smell.
Flowers.
Okay, close this one. Okay, close the other. And it smells, you get the scent? Okay, perfect. Now what I'm going to go on to next is cranial nerves number 9, 10, and 12. And first, I'm going to begin with your lips. So there's no cyanosis on the lips, open mouth. Okay, mucosa and tongue are pink, hard and soft palate are intact. Say ah.
Ah.
Okay, perfect. Vulva moved, no evidence of tonsils, so that means we're at a grade 0, and no evidence of dental work as well. Stick tongue out all the way to your chin. Okay, move it side to side for me. Perfect. All right, and now I'm going to actually test your gag reflex. Give me 1 second. Stay right there. Okay, open your mouth. All right, I'm just gonna go back. Oh, right. See, so gag reflex is awesome. Next, I'm gonna go actually check your respirations, but first I'm going to inspect your neck just to double check that there's no lesions or anything. So I'm gonna bring you just a little bit forward right here, like this. Okay, lean up just a little bit, sit up straight. Okay, let's see here. Let's see, but before I begin doing this, do you have any history in your family of lung issues, pneumonia, TB, smoking? Perfect, okay. And now there's no lesions, skin is intact, it is pulsating. Now I'm going to listen to your carotid pulse. I'm gonna take the bell of the stethoscope. Inhale. Exhale. Inhale. Exhale. Good. Okay. There's no bruit, so that's perfect. Now I'm going to check your thyroid. And what I'm going to do with that is I'm going to come around here to the back. I'm going to have you scoot the chair just a little bit for me. I'm going to come around here, check your thyroid. All right. Now swallow. Okay, swallow one more time. All right, perfect. Now I'm going to check the skin on your back. No bruising. It seems to be looks good. No lesions or anything. I'm going to check your back expansion. I'm going to cup your lungs right here. So check your lungs. All right. And breathe in. Breathe out. Breathe in. Breathe out. Okay. And now I'm going to check for crepitus. Say 999.
999.
Say it again.
999.
Scoot up just a little bit. Just a little bit. There you go. Say it again.
999.
Say it again.
999.
And one more time.
999.
Perfect. Okay. All right. Is there any tenderness? I'm going to do this method right here. I'm going to take my hand and just place it on the back, and I'm going to tap it. Any tenderness? Okay, I'm going to do it on the opposite side now. Any tenderness? Perfect. Okay, and let's see here. Now I'm going to percuss. I'm going to take my fingers and just tap them on your shoulders, okay? Okay, notes were resonant sounds, so that's good. I'm going to oscillate. I'm going to start at your C7. Okay. Perfect. Everything sounded good. No concerns, no crackling or anything. Now I am going to do your interior side as well. First, I'm going to, let's see here. I'm going to just observe the skin, make sure there's no lesions or bruising. Doesn't look like it. Looks perfect. Look at me. Trach is midline. Now I'm going to feel for chest expansion in the front. Okay, breathe in. Breathe out. Okay, and now I'm feeling for crepitus. Say 999.
999. 999. 999.
Okay, and okay, now I'm going to oscillate your upper